Hey, what's up guys? My name's Student Dr. Sample and you're watching OMM Consult. Let's get started. Alright guys, the focus for today's video is not on a specific technique. Instead, we're going to focus on an entire category, the lymphatic system and the lymphatic techniques. Because why do we use them and why do they exist? Because I can tell you all these different techniques, but knowing how to do a manipulation or how to do a lymphatic pump, that's easy. It's the understanding of why we're doing these things. Because if you understand the why and you know your anatomy well, then you don't have to waste time learning all these different techniques. You'll understand this is the problem that I'm trying to solve, and in order to fix it, I have to change this, this, and this in order to solve the problem. So what's the idea behind lymphatic techniques? Well, the basic idea is that in order for your immune system to work properly, you have to have good lymphatic flow. In order to have good lymphatic flow, you have to have good blood flow. So the idea behind all of these techniques is that we're trying to make things flow smoothly. If there's any problem in that, if there's essentially a kink in the hose, then we have a problem. Now, as an osteopathic physician, there's two ways that we need to tackle this problem. There's the first, which is what antibiotic do I need to give for this specific infection? The second is how can I manipulate the body to remove any kind of restriction that might be impeding their lymphatic flow or their blood flow? If you have good blood flow and you have good lymphatic flow, then they can heal faster. Now, when we focus in on lymphatic techniques, they're actually pretty new. Before then, the thought was, well, doesn't any technique we do technically change blood flow and change lymphatic flow? Well, yeah. But there are certain techniques that have a more specific and profound impact on lymphatic flow. Now, one of the topics that is often brought up at osteopathic medical schools is the flu of 1918 and how osteopathic physicians had a higher survival rate for their patients than their MD counterparts. But the reality is that had nothing to do with lymphatic techniques. They hadn't been created as a category yet. The thoracic pump hadn't been created yet. In all reality, they were just doing soft tissue techniques and articulatory techniques. And this just goes to show that you don't have to know a specific technique. If you understand what you're trying to accomplish and you understand the anatomy, you can solve a lot of problems. But that was then, and this is now, and we do have lymphatic techniques. So the question is, why do they work? Well, there's two main philosophies behind this. The first is that there's something that is blocking flow, like a kinked hose or a dam in a river. Nothing can get through, so let's just remove the blockage. The second is a problem with autonomics. There is something wrong with the sympathetics or parasympathetics getting to that specific area, and it's having an effect on the diameter of the lymphatic vessels. So if we can have an effect on the autonomics, then we can possibly change the diameter of the vessel and therefore change the flow rate. Now, there's two different styles of treating the lymphatics. There's intrinsic and extrinsic. Intrinsic is if you're fixing somatic dysfunction of the thoracolumbar spine. This will help normalize the sympathetics and help change the flow rate through the lymphatic system. For extrinsic, this is more for muscle contraction. As you move your muscles, you move the lymphatic fluid through the lymphatic vessels. Now, when do we use lymphatic techniques? Well, unfortunately, I can't just give you a list of things because a lot of it really depends on your patient and how they're presenting. What's good for one person might not be good for another. The only thing I can really say is that for absolute contraindications, the only one I could actually find was necrotizing fasciitis. Other than that, a lot of it is based on your own clinical judgment. Now, I know this video wasn't all-encompassing and I didn't show you any treatments, but what I wanted to get across was the general idea of why we're doing this. Because you know the anatomy, and if we can combine the anatomy knowledge with the philosophy of lymphatic techniques, then you don't have to spend a whole lot of time studying different maneuvers. You can combine the two, and you can help your patient in advanced osteopathy at the same time. Alright guys, thanks for watching. If you have any comments or questions, go ahead and leave them down below. If you like what you heard today, go ahead and like and subscribe. I'll see you next time.